Welcome. In this instructional video, we will listen in on a conversation between Medi-Cal Rx and Dr. Smith as they discuss Reject Code 76 and how to resolve. Our hope is that in hearing this conversation, it may help some providers with similar situations. Let's listen in now.
Oh, hey, Dr. Smith.
Hey, Medi-Cal Rx. Do you mind if I ask you a few questions?
Not a problem at all. Please do.
Thanks so much. Okay, so I'm a CCS paneled provider and I have a member who is 16 years old. I recently prescribed them chloroquine, but was having an issue with the claim.
Okay, happy to help and thank you for that info. Let's first take a look at that drug on the contract drugs list so we can see if there are any potential Code 1 restrictions. Now, while I pull that up, could you please tell me what reject code were you receiving when submitting the claim?
Sure. When I was submitting the claim, I was receiving reject code 76 for plan limitations exceeded.
Okay, good to know. I have pulled up chloroquine on the contract drugs list, so let's go ahead and take a look. If we go along the row for this drug, we can see the dosage, strength, and unit, and then the applicable types and Code 1 restrictions. In this case, it looks like this drug has a quantity limit, indicated by the QL in the type column. If we look in the Code 1 column, we can see more details, restricted to 60 tablets per dispensing.
Ah, that makes sense. I prescribed 90 tablets, and since that is above the quantity limit of 60 tablets per dispensing, I received reject code 76.
That's exactly right. You can resolve this rejection a couple of different ways. Now, one option is to prescribe an alternative therapy if medically appropriate. You can also consider a change in dosage if appropriate. Or you can submit a PA to Medi-Cal Rx to establish medical necessity for the needed quantity.
Thank you so much for that information. But I did think that CCS panel providers didn't have to submit PAs to Medi-Cal Rx.
Now, that is somewhat true, but only for certain situations. The CCS paneled provider authority policy only applies to reject code 75 for prior authorization required, with some exceptions, and reject code 83 for duplicate claims if submitted for an enteral nutrition product. Some other claim rejections, such as quantity limits or cost ceilings, may still result in a PA request being submitted based on the given situation. Medi-Cal Rx encourages looking at the CDL when prescribing, like we did today, so you can be prepared for any potential rejections and plan ahead. Now, in most cases, if a PA request is necessary, it can be submitted in advance to avoid any potential delays in care.
That is great to know. Thank you so much. I will be sure to take a look at the contract drug list in the future. Is there anything else that I should take a look at?
Definitely. Medi-Cal Rx has a ton of educational materials on our website and our YouTube channel. Just go to the Education and Outreach page on the Medi-Cal Rx provider portal to learn more about all things Medi-Cal Rx.
Awesome. I'll check that out. Thank you so much for your help today.
Always happy to help. Feel free to reach out anytime. I'll share my contact info with you. Have a great day.